No, no, ma'am. I opened the
Yes. Apologies for the inconvenience. I had some photographs that I wanted to show you in the PPT, so hence the wait. I am Meghna A Singhania, and I'm going to talk to you about the role of media and the missing link, what it creates in when we are talking about sustainable healthcare. First of all, thank you for having me here. Thank you, Dr. Alex. Thank you, Health. Thank you, PHFI, Yashoda Hospitals, for giving me the opportunity to talk about the role of media and what we can do when we talk about sustainable healthcare. But before I start with my conversations, I would like to walk you through some images. Anybody familiar with these pictures? So these are pictures which were taken by a journalist, Madhuraj, who was documenting the faces, the stories of the victims of the tragedy of Kasaragod. Now, for those who don't know about it, it was the tragedy started actually with in 1970s when the Plantation Corporation of Kerala started throwing a pesticide containing endosulfan in that particular district on the cashew crops. And what happened is by 1990s, residents began reporting serious health defects, including cerebral palsy, hydrocephalus, epilepsy. The doctors in the area, the journalists in the area, and the activists related it to the endosulfan cause, including Dr. Y.S. Mohan Kumar, Sri Padre, a farmer journalist. And this was brought to light by certain media houses, including Down to Earth magazine, which reported the plight of these people in these villages, and then began a decade-long fight for a battle against this endosulfan. What happened at the end? In 2011, the Supreme Court of India banned the production and the sale of endosulfan. It was the first time in the world that it was done. This example was an example for the world also that prompted to ban the particular component, endosulfan. And in 2017, the Supreme Court of India went ahead and announced a further compensation of 5 lakh rupees for the victims and moving towards rehabilitation of the people in that area. The battle is still continuing for them, but there is some closure. Let me talk about the next image. Oh, before I say it, so can I take, as a media person, can I take the credit for that? No, it was the battle of the residents, it was the battle of the doctors, it was the battle of the activists, but media did play its role. You know, it would have remained a very small case of a small district in Kerala, but it was brought to national and international light only because the media began to report it. The next image. For those who don't understand Hindi, this is saying Bhopal is sitting on the edge of a volcano. And this goes back to the Bhopal tragedy. This article, we know the tragedy took place in 1984. This article was penned down by Rajkumar Keswani in 1982. In fact, he wrote a series of articles, with very dramatic and heartfelt headlines. Please save the city. If you don't understand this, you will be wiped out. Bhopal is on a brink of disaster. He kept on warning about what's going to happen. Unfortunately, his voice didn't make an impact. So this was also, while I talk about the positives of media, this also shows the limitations that we have. We didn't get the closure there. The next example, what do you see in these images? Anybody? Nothing? Well, this is what we see in Delhi every winter. It's the pollution. So, but as a layman, I I'm not, going back to my science of maybe class 10, 12, I relate pollution as having serious health effects in terms of respiration. But no, you are doctors here, medical practitioners. Pollution has an impact on every organ of the body: cardiovascular, brain health, reproductive health. Now, I am not going to go, as a layperson, I'm not going to go to ask my gynecologist, okay, what is the impact of pollution on my reproduction? That probably is not going to happen. And my gynecologist may be aware but not be telling me so, because I have not asked that question. But how do I come across these facts? How do I know about these facts? Is because of the media. Is because of the repeated articles which are being highlighted. So what's the role of media in the cause of sustainable healthcare? Well, when I was doing research on this topic, I came across this beautiful diagram which was talking about the various stakeholders of sustainable healthcare. Their providers, patients, hospitals, all the probably representative of stakeholders, which are present in this room today. I was a little disappointed because I could not see media as a stakeholder in this particular diagram. This is a document for Vision 2030 for sustainable healthcare. And when I was reading more about it, the article was saying that sustainable healthcare is less of an infrastructural issue but more of a communication issue. And that's when I realized that media is not the circles that you see in the diagram. Media is actually the arrow that's connecting all the stakeholders. So, but why does sustainable health need a story? Why do we need a narrative? Why do we need media? Because on its own, we have scientists here, we have environmentalists in this room, we have doctors. We assume that the story, the sustainable healthcare story, for a lay person is always too technical. It's always looks institutional, looks policy heavy, big words. I don't comprehend it. So we need the media to translate the story, to make it understandable, and to make it doable. Like, yes, no, I can do it. So again, we had Poonam ma'am talking about a few minutes ago about standards. So standards define what is sustainable healthcare. Technology enables how to do it. We have partnerships forging in this room that will help us implement it. The ESGs will measure, but the media will make it visible. And that's what we focus on. So how can media support sustainable healthcare? Well, we're not doing any rocket science as media. We join hands with you. We investigate the issue. We take it a point to inform the public. We make sense of it. We make it simpler. We try to influence, and we try to collect and unite stakeholders of different, of areas, join hands together, and hold whoever is accountable. Before I move on, I would like to talk about the final point is why and how we can do it, how we can build sustainable healthcare narratives. This is more for media persons in this room. We have to move away from crisis reporting to prevention storytelling. It's not that, oh, this has happened. We have to go one step backward. We have just learn something from Keswani and try to warn beforehand. Moreover, we have to move away from negative stories to positive stories. In media terminology, negative stories always draw more traction. They always draw more hits, views, readership. But it's the positive stories that leave a long-lasting impact. So we have to move away from negative stories to talk about positive stories. We have to celebrate models, which are worth copying. So it's important that when we tell positive stories, we have to tell this was the case, this is how they did it, this is what they achieved. Like Poonam ma'am was giving an example, this is the hospital, this is what they did, this is what they got. Imagine if other hospitals knew that by investing 12 lakhs in a year on lights, I can probably in 15 months save those 12 lakhs and have a constant earning, further saving more. That is going to inspire other small hospitals also to implement it. More importantly, and what is important for us, is to follow up after the headline. It's not just about one story. It's about repeated drilling on the point again and again and again. And this brings me to another example. Dr. Alex is in the room. Around 10 years ago, when I was just started off my journey of medical dialogues, I came across a very small gazette, which was a two-line gazette that DNB is not equivalent to MD anymore. So doctors will have a more understanding of that. The mainstream media was obviously not interested in the matter. I didn't comprehend the matter till somebody sent me a message saying this is not fair. And that's when I came across Dr. Alex. He explained me the issue. We joined hands together. I think in the past 1 decade, Dr. Alex has gone from pillar to post, PMO, Health Ministry, NMC, asking for equivalence of DNB and MD. And later on, we were joining hands with him. I think I've reported more than 50 stories on this matter. And finally, thanks to you, Dr. Alex, we got that closure also. So anybody who's doing DNB in any private hospital and wants to have the career of a teacher, medical college, you know who to thank. And Dr. Alex running around for 10 years getting that. So thanks. And that's another point that I want to make. It's not just one story. It's repeated story. We want to talk about sustainable healthcare, we have to keep on talking about it. But more importantly, apart from media, it is also, I would like to appeal to the members in this particular room, that you also have a role to play. Why? Because it's your story. If there's a sustainable health story, you have to own the story. You have to go out to a particular journalist and tell them. If you don't tell your own story, why do you expect a journalist to tell it? More importantly, you have to make them understand and believe. So I gave the previous example, if a journalist understands your cause or your fight or what you're trying to say, they will report the story. But if they are able to relate to what you are saying, you will find that they are going to raise the issue more number of times than probably you do. More importantly also, you are doctors here, you are medical practitioners, you are environmentalists, you know the facts, you know the numbers. Don't assume that the media knows everything. They are again like jack of all trades, but you are the masters. So you have to make it understandable to them. And more importantly, also give them stories, give them narrations. It's not just one line or big fat line that I've made. It's make it understandable. Give them stories that others are able to emulate. And more importantly, also one more final point, we have the social media now. With social media, it's a very big equalizer. Everybody has a chance to get a tinge of media. You can go out and make your own stories using an Instagram reel or YouTube shorts. You can tell your own story, but use it responsibly. Do not use it to abuse, but to inspire. So that's sort of my take on how we can build up sustainable health narratives. As I don't want to keep you away from your lunch, if anybody has any sustainable health story, please while eating food, let's have a quick chat. Thank you.
Thank you, Meghna, for that sweet and short account from your side. Most of it covered probably self-discipline matters. But however, I wish there are more journalists listening out there, because all healthcare issues, as you said, if it is preventive or if it is forecasting, it doesn't have the sensationalism which the media grabs attention for. So that probably comes in between the reporting of something which after happening, because it has more readership or viewership, and the other preventive things fall apart like any other thing what we talks about. Yes, well, we are when we are aware of, I guess we can reach out to more journalists. But however, journalists, I did try a couple of times with no avail. So maybe your kind of journalists we would like to see more, and there's a lot to talk. There's a lot to write about, and for the general public, as I said earlier, there's a lot of misinformation out there. Well, I don't think we have time for questions. Do we have? Okay, maybe a couple of questions. Yeah, if you don't mind cutting into lunch time, yes. Please make it short.
It was a wonderful presentation, especially when you talk from negative
journalism to positive journalism, which is hardly seen in our country. All negatives on the front page, positive things are not there in the. When I talked to one of the journalists, he said, "अखबार पहले बिकता है फिर छपता है." So you are saying, you give your story, it will never be there, as Madam said. So पहले वो बिकेगा. If you don't, if a hospital doesn't give advertisement, they will not print in the media about its new technology coming into the city, into the hospital, because they think it is an advertisement. But it is, in fact, it is a positive news for the society that a new, for example, robot has come in the city first time, a new nuclear accelerator has come. It is for the general public, but if you don't give the advertisement, they will not. So I was a witness for the gas victim also in 1984. I did MD in that area. Yes. So negative journalism, one more example, like smart meters, it was there. Yes, a quick example, like smart meters when they came, everywhere in the TV it was there that in UP and Bihar they have taken out the smart meters and they have all fired. But nobody questioned why no journalist gave the answer why it is bad. When he asked one of the chief engineers, what is so special about the smart meters? So smart technology was there in the morning. So he gave a question, he gave the answer. During the daytime, the rating is 20% less. Your billing will be 20% less during the daytime. So you can, while your shops, your factories are there, will consume more energy at a 20% less cost. During the night, in order to sensitize the people, use less electricity, 20% more is the rating. So this is one difference. Secondly, he said, the persons who used to come on motorcycles to take your readings, they used to...
And the time is over for the question and answer sessions. And
Feel free to connect with me during lunch.
yeah, during lunch.
Wonderful listening to you. And on the lighter side, you perhaps missed us Delhiites standing in that picture of Delhi show.
Maybe, sir.
My question straight to you is, as a media person, my name is Rajiv Krana, I'm the founder trustee of Lung Care Foundation. As a media person, what do you think should be done to galvanize the energy of the media to especially work on 3 alphabets, Bha in Hindi? First, Bhav. How much value people as well as the doctor community give to this sustainability cause. Second, Bhavna, the commitment for action. And third is Bhay. Because Bhay bina priti na hoye gusai, and unless and until people are shit scared of this, their changes are not going to happen. So my query is, how should media professionals actually galvanize with a strong power to actually get the whole thing implemented? Thank you.
Well, first thing is to talk to more people like you. As I mentioned over here, don't assume that media persons know everything and they probably move on from one story to another. And so it's actually the duty of the medical professionals. That's why my last slide. I'm not an expert. I don't understand things. I don't know what a beam hospital is, by the way. But if you come and explain it to me and you give me an example, I will be happy to understand it. And as I said, the moment I understand and I relate with your cause, I will be your ally to join hands with you to report on it.
Thank you very much, Ms. Meghna A Singhania. And thank you very much for all the audience for a wonderful participation. I request Ajita Nair to kindly present a memento to her, and she will in turn present the memento to you. So we break for lunch. We had a very, very engrossing session in the first session. So I request all the speakers, eminent speakers, and the panelists and the co-chairs and chairs to kindly proceed to the 7th floor. We have for all the faculties, we have lunch arranged to the 7th floor. Rest of the delegates can have lunch on the 5th floor itself. We will meet in 45 minutes time. Please time yourself. We'll start the session sharp at 2 o'clock if possible. So please have your lunch. We have served very good lunch, but then just be back in 45 minutes time. Thank you.